Afternoon, Dr. Blood. How are you?
I'm doing well. Thank you for having me.
No problem. Could you start off with a little quick introduction, who you are and what you do?
Yeah, sure. So my name's Alex Blood. I'm originally from Dayton, Ohio. I went to UC for undergrad, where I was actually a Spanish major, but also took some pre-med classes on the side because I pretty much knew coming in that I wanted to be a doctor or something in the healthcare field. So even though I took my degree was in Spanish, I wanted to make sure I had those pre-med classes. So I went to Ohio University Heritage College of Osteopathic Medicine for medical school in Athens. And then I just finished my residency in family medicine in Columbus, Ohio at Grant Medical Center. And then I'll be staying with the Ohio Health family doing outpatient primary care in the Columbus area starting in August.
Why did you choose to be a Spanish major?
So I really like wanted to set myself apart from others on my application. So when they tell you you can apply to med school, like you can have any major, but you just have to make sure you do those pre-med requirements. So I took Spanish in high school. I had been to Mexico on mission trips a few times, and back then I was like, oh, I want to go and live in a Spanish-speaking country and be a doctor. Specifically at an orphanage in Mexico that I had been to. I was like, I want to go there someday and be a doctor there, but um, it was just like my interest at the time, and I really thought I saw myself going to another country to be a Spanish speaking doctor. But I mean, turns out in the United States, we're able to use I'm able to use Spanish with some of my patients. Like we have such a diverse country that I'm able to use that with some of my own patients now.
Why did you decide to become a DO rather than an MD? And then could you also talk a little bit about the differences between MD and DO?
Yeah, sure. So one of the first people I ever shadowed before medical school was when I was still a student at UC. She was a DO, family doc in Springfield, Ohio, and I just loved the way she interacted with her patients, and she just had like such a warmness about her, but like also a realness too. She was also a black doctor. I just felt like she really took in the whole patient when she was in those encounters with them. And so she would listen to them, like just taking their whole picture, like, why do they have diabetes or why do they have this low back pain? So that's one of the reasons like I really got more interested in osteopathy because DOs are known for having a holistic approach to patients. Like, is it something in your lifestyle that's making you have this ailment, or is it because you're doing this repetitive motion at work is why you have wrist pain or things like that? So I feel like DOs are really good at like seeing the whole patient and just taking that into account when trying to figure out the next step for their care. So that was one of the things that drew me to OU. So OU is a DO school in Athens. They also have a Cleveland campus and a Dublin, Ohio campus. So the school is really growing. Um, but as far as like our training, so we still do the standard 4 years of medical school. We do the standard curriculum, like you still have to know your anatomy, you still have to do all the different blocks that you have in a typical medical school, just like if you're going to UC's medical school. But in addition to that, we get more of a comprehensive approach to osteopathy. So we learn more about like how manipulation of the bones or the muscles can facilitate healing of the body. Um, so what we call so one of the techniques that we use is called osteopathic manipulative medicine or OMT or OMM. You might hear it called those things. And so those are ways to diagnose as well as treat patients based on like, oh, I feel like your shoulders are really tight. It just depends on what the patient's coming in for. Like, so like you might have a tight shoulders, and like there's different techniques that we can do to kind of loosen up the shoulders and help their low back pain or help relieve their headaches. Um, so I think that's a few of the reasons like I just was drawn to osteopathy is because more patients like they don't just want medication to heal themselves. They want like other things that they can do at home or other things they can do to help heal their bodies. Um, but if that so as far as the training, like I said, same 4 year curriculum, but we learn some of those osteopathic manipulative treatments that we can do in addition to help our patients.
And you said you just finished residency. Can you talk about what a typical day would be like, or what is what is residency like, and what a typical day and during residency was like?
Yeah, so I went to Grant Medical Center in Columbus. It's a full spectrum family medicine program. And when I say full spectrum, so we do OB care, we do inpatient, like hospital care, we do outpatient, like your typical office care. Um, we do a breadth of experiences. So some of the family medicine programs, they focus mostly on outpatient care, mostly on other like depends on the program, but my program we do a ton of things. Um, so the residency was pretty busy because we do cover all of those different services as far as like OB as well as being in the hospital. So it really just depended on what rotation I was on at the time. Like OB, we're up at you got to be at the hospital like 6 a.m. You're working a long day till like 12 or till a 12-hour shift. So 6 a.m. to 6 p.m. That could include delivering babies. It can include putting birth control in for the moms that have already delivered. If I'm on the inpatient service, so that's like the sick patients in the hospital, we have a rounding service where we would meet with our attending or like the supervising physician. So even though I graduated from medical school and I was a doctor during my residency training, I was still in training. So my attending physician had to be there to co-sign orders or supervise what we were doing when we were taking care of patients. So the inpatient team, we go see our patients, come back with our attending, go over the plan, figure out how to, admit patients, discharge patients. The outpatient office, so that's a little, I wouldn't necessarily say more relaxed, but you come in at like 8 o'clock or, it's like more 9 to 5 kind of a job, see 10 patients in a half day. And in the outpatient world, you can do, so at my residency, we learned like how to put birth control in or how to do knee injections, toenail removals. Like I got to do OMM in the office as well. So it's not just like talking to the patients about their medications, like you still have a hands-on experience. Yeah.
And residency is notorious for being a very isolating and busy time. So how did you keep your mental health in check during that time?
Yeah, so that's a really good question. Especially like our program is really busy, so just relying on like my classmates, like we did something every month. We did potlucks every single month from the beginning of residency and almost till the end. COVID kind of stopped that, obviously, so we weren't getting together, but so like that was a way for us to come together outside of the hospital and somebody like everybody would bring food or we would go somewhere like didn't necessarily have to be like a potluck or a traditional potluck. Maybe we'll just go out for some drinks or something, call that the potluck and go to trivia or something. So my class was really close, like we would do things like that. Speak like just making sure I was keeping in check with my family members, like when I was stressed out, like like my mom sometimes would come and stay at my place for a couple of days, like cook some food or bring some food or things like that. So um, I also like, you don't want to lose yourself in residency or medicine. So like the things you like to do, like one of my friends, she was like a super volunteer. Like she was, I don't know how she did it, but she was involved in like leadership projects, like, and she was volunteering. So that was something that was like part of her wellness. So I would say like, when you're in medicine, like don't lose yourself, like work out like you want to, like try to eat as healthy as you can, like volunteer, like I would travel when I could. So I made sure I had enough money in my budget that I could still do some of the things that I like to do.
And with being a minority, how did that affect your experience in medical school and in residency?
Yeah, so at OU, we actually there's a program called Summer Scholars, and so that program was focused mostly on minority students coming from underrepresented backgrounds and helping them matriculate into medical school. So when I went to, so that was at OU, and you don't have to go to OU after you go through the program, but luckily that was a summer, 2 summers before I started at OU. And I had some friends going into the actual program with me once I started medical school, but it can be overwhelming when, you know, the majority of like medicine is still very Caucasian. There are more females that are in medicine now, but it's still like a very white or predominant world. Um, so when you walk into that first like big lecture hall and there's 150 people and you only see like 4 or 5 people like yourself, it's like, okay, well, at least I see somebody who might share some background as I do. Um, but some things that I did, like when I was in medical school, so there's the Student National Medical Association, SNMA. So like my friends and I got involved in SNMA, and like that encompassed like people in the second year class, a third year class, a fourth year class. So at least we were able to have like other people that looked like us that we could talk to across the country. Um, that could help us through our experiences at med school or in med school. Um, but I think like it is interesting because like it's like a two-sided coin. Like, of course, like I'm proud to be a Black woman, but there are days where I've heard patients, or not necessarily to me, but I've had friends that a patient would say, "Well, I don't want to see a Black doctor." So like, you know, that's unacceptable. Like in our office, we're very like we wouldn't. That's not an acceptable thing to say, and like that's not something that our office, like where I went to residency, like that patient, the one patient I'm thinking of was addressed, and like if that's not what, if you don't choose to come here to get your care, then that's fine, but we're not going to tolerate those kinds of behaviors or those kinds of things. Um, so like you hear things like that, and then you also know like there's so many people who go through medical school who are the only Black person in their class, and they feel like they are the outsider, or when they do bring up an issue, like they feel like they're not being heard because they're not part of the majority. I'd say that's another part of like med school too. Is like there's so many people that come in, their parents are already doctors or their grandfather's a doctor, and like I didn't have that in my family. Like I didn't know like some of these things, or I didn't have all of the experiences. So there's a lot of patient or a lot of students that come in that are like a legacy, that have that as their background as well. But going back to just being a Black woman in medicine, so like I said, it's a two-sided coin. So I have patients that seek me out and they're like, well, I wanted a doctor that looked like me, that understood, this is my background, or my hair is different because of this or XYZ, or like somebody who can relate to some of their experiences. So um, I've had patients like one day I can't, like one of my very first patients in residency, I walked into the room and this it was an African American lady, and she's like clapping for me, and she's like, I'm like, oh, why are you clapping? She's like, because you're a Black doctor, like so sometimes patients seek that out, or they're just really proud of you, or they want to keep following you because you have that shared background. You can be a mentor in the community, so that's also like the great thing about being a Black woman in medicine too.
I know you already talked about this a little bit, but what do you think some more lasting effects on diversifying the healthcare field, whether it be doctors or PAs, nurses, anything like that? What effect do you think that would have on other Black students in the Black community? Not even just Black students too, but students of all backgrounds.
Yeah. So the US is becoming more and more diverse. I mean, like it's not what it used to be like in the 50s and 60s. So there have been studies where they've shown that patients are more adherent, or like they come to their doctor's appointments more often when they identify with the physician or the PA or whoever they're seeing in the office, or whoever they're seeing like in the emergency room. Like there have been studies that have shown that patients do better when they do seek out somebody, or they happen to have a doctor that looks like them, or whoever that looks like them. So I think it's important too, because even the nurses, like on the medical floors, like in the hospital, like they can advocate for their patient, or like sometimes patients feel like they've been brushed off if it's somebody from maybe a different race or whatever, a different religion. Like, diversity can be religion, sexuality, like ethnicity. So, like, at our program, we're really like at my residency program, we have an LGBTQ population that comes to our office, and they know it's a safe place for them to talk about their needs. So, I think it's really important because we are different. We're not just a one group. We're not just a homogenous group anymore. Like we're so heterogeneous. So, um, I think it'll be a better outcome for the patients as we continue to recruit different people of like different backgrounds for the medical field. And that's, like you said, every level: nurses, doctors, PAs, physical therapists, pharmacists, dentists, everything.
Okay, I like that answer a lot. And if you had one piece of advice that you would give to aspiring DOs, in the medical field, what would that be?
So I would tell anybody trying to go through the medical field, persevere. There will be days where you're like, I can't do this, like I'm not smart enough, or I didn't get the A's, like I'm too busy, I need to pay for this or XYZ, but persevere, like you can do it. I had a professor, not at UC, but not at medical school either, but at a different time that had told me like, oh no, I don't think you're ever gonna get into medical school. Like I'm just really sorry, but I just don't think your grades are gonna be like where you need them to be. And here I am. I'm a doctor now. So like just because one person counts you out, don't count yourself out. Um, and I'd say stay focused. Like I went to UC. I know what it's like. Like there are so many opportunities to get involved or like to not necessarily party, but like there's always gonna be a party, another party. So like if you need to study and you need to go to the library and isolate yourself, then do that. Um, and lastly, find a mentor because that's how I got here. Like somebody took an interest in me. I was able to go shadow. They were able to write letters of recommendation for me. So network, 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 and get yourself a mentor.
Sounds good. Dr. Seltzer, do you have anything else?
No, I think this was really amazing. I'm going to go ahead and stop the recording and then we can wrap up.